I'm Darla. I am the nurse injector here and one of the owners. I've been injecting for about 17 years.
And I'm Stacy Childs. I am a co-owner as well. I do all of the light-based therapies, and anything that Darla doesn't do is pretty much my department. Today we have our first face of inspirations. Kim is here. Darla's going to have her go through a regular assessment, and we'll figure out what the best treatment plan is for her.
Okay, so what I want you to do is just look at yourself in the mirror.
Yep.
Tell me what it is. What do you like? What do you not like? What are your concerns? You know, what would you like to see different?
I always get sensitive about like the crow's feet kind of thing, and then just the texture I've noticed is not as smooth as it used to be. I don't like this under here. Like no matter the weight I have or don't have, I can't like this little bloop of.
Okay, so this and this can often be addressed just by tightening your skin.
Skin tight, which is energy based. We put a lot of heat into your skin, and over multiple treatments, it just kind of tightens everything up. It doesn't hurt. It just feels like you're in the sun, like you're just warm feeling. Sometimes you might get a little hot spot here and there, but we know when you start wiggling that it's time to move to a different area.
It's all good. So we think about like droopy eyelids and that type of thing, but.
So what I would do for the things that I offer, starting from the top down, and the crow's feet, smile really big. I mean, yours aren't bad. You don't have a ton of muscle movement there. So as far as what I offer, like with the toxins, like Jeuveau, Dysport, would address.
You've already got like ideas and
designs
on my face, don't you?
So I can address these lines, and there's a couple different things that we can do for that. One is the toxins, which is the Jeuveau or the Dysport. Downside of that is it is going to affect the muscle movement in there, and you're a teacher, and
this teacher
talking, and so I don't want to affect your speech at all.
No.
So I would go more towards, if we were gonna do something in there that I offer, I would go to threads. And put the threads in there, and the threads are like a dissolvable suture material that we put under the skin there, and usually at about 3 months it's going to start to dissolve, and it's replaced with collagen. We usually do 3 treatments of that, about 6 weeks apart.
Cool.
And that will do is when you talk, you pull up on your chin.
Do I?
And that can cause, some of these lines down here. I would put a little toxin in your chin to stop you from doing that.
Stop me from doing that.
Yeah, so that helps with this line. Right here,
Yeah.
and just relaxes that. So that helps with it actually makes your jawline look a little tighter. Because it elongates everything, as it kind of points your chin down. So those are the things that I would do. You don't really need a lot of what.
So how good have you been with your sunscreen?
So typically really good. I usually incorporate that with like my foundations or like moisturizers and whatnot. And I, in the past, have been somebody who's laid out in the sun. So
I think probably we'll start you out with a BBL. Potentially Tixel combo. So BBL is broadband light. And what it's going to do is it's going to target all of the browns and all of the reds in your skin, and kind of the browns will turn a little bit darker and then kind of slough off. The reds take a couple days and they just kind of absorb back in. 1 to 3 treatments maybe is what we're going to need for you for that. Tixel, on the other hand, is it uses heat, and it's kind of like a little gun guy, and we just go all along your skin, and it puts little imprints into your skin with heat, and it causes micro injuries that are going to make your skin push those out and create new collagen and elastin. So it's going to help with your tone and texture. It's going to help We can go right around the eyes with it, like even on the eyelid, which we can't do with any other lasers. So it's gonna tighten that up around the eyes, reduce some of those lines that you're concerned about. Even the laxity in your eyelid, it'll help with that as well. And I think that those two together are probably gonna be a good bet going forward. And then we'll just work on skincare to get you.
I mean, two things that treat my skin, and then the Neutrogena Hydro Boost for moisture, and then the cleansers. Sadly, something
There's
I found in
nothing
the back.
wrong with those types of products, though. There's no wrong answer to this.
I'm a teacher. There could be. No, just kidding.
Well, over-the-counter products, things like what you're using.
Yeah.
Legally, they can't penetrate your dermis, so they're just kind of sitting on the surface of your skin and not making like any real physical changes in your skin. They're good for what they can do.
Yeah.
It's just if something penetrates, it's more towards the medicinal side, and it's regulated.
So we've got some texture going on up here.
Not real happy about
So
that.
we'll
A
do.
little curling iron.
I know.
Assumed.
Little curly.
I
iron
assumed
burn.
that there was a curling iron burn there. What I think, if the Tixel doesn't address that, we can do some Skin Classic with it, and it'll kind of smooth it out a little bit.
Isn't that nice?
The little bumps that you see there, they're not acne. It's called sebaceous hyperplasia, which is just, it's like your oil glands are, kind of scarred open a little bit.
So this is that, I know it's like, again, like a teenager, this is that opposite.
Yeah. So you're overproducing the oil because your skin is too dry. So we need to get you nice and hydrated. So knowing that, that'll help me pick products for you that are gonna get you glowing.
Cool.
All right.
Yay.
We're gonna start with the salicylic cleanser. It is great for hyperpigmentation, which we've got a little bit of. It's also going to help, it's a chemical exfoliant, so it's gonna help kind of get some of those stuck dead skin off. But because that's not enough, I'm gonna throw in the skin polish. It is a physical exfoliant. So I only want you to use this once or twice a week because I don't want you to overdo it and strip your skin to make it drier and produce more oil.
We don't need that.
Because you indicated that you were dry, we're going to do the HA Immerse Serum. This is morning and night.
Okay, cool.
It's one pump.
For the whole face?
For the whole face. And then during the day, we're going to do Ultra Light Moisturizer. That's your last step, or your second to last step. Because you wanted something for your eyes. So we've got the Ultra Firming Eye that we're putting on there. And you can use that both morning and night. Just don't get too close to the eyeball. All right, last during the day, I want you to use this every single day. It's Hydro Tint, Pro Mineral Sunscreen. It's got titanium dioxide and zinc in it. So as opposed to stuff that you can get at the store, which is going to be just more of a chemical sunscreen, this has got those minerals in there. They're going to physically block the rays. So I feel like it hangs out a little bit longer during the day than what that chemical stuff is going to do. And I get, even at night when I'm wiping my face off, I can see that tint is still there, so I know it's still working. If you're gonna spend a lot of time outside and you're sweating, you might want to reapply. And anytime you're out for longer than 90 minutes, we suggest reapplying.
Would you suggest any of that here or
everywhere?
Everywhere.
If you want to use it all there. One pump of all of this is the dose of the product. So a little bit goes a long way. This is a 3-month supply.
Beautiful.
It'll last you
Thank you.
forever.
Yay.
Or for 3 months.
Or for 3 months.